All right, we are going to get started. This is week 3 of the 4-week onboarding calls. How did it go last week with Shelly? Good. Did y'all give y'all some kind of good tips and tricks as far as marketing goes?
Yeah.
Good. All right, I'm going to do a screen share and we will get started. All right, here we go. Okay, so the big thing that I want to kind of go over today as far as operations is going to be how to label your product. So whenever you get a bottle from corporate, it is going to come in the original bottle from the manufacturer. And then Stephanie, our inventory coordinator, she will put a sticker on top of the bottle. And that's where you will put your initials, the date that you reconstitute it, how much you reconstitute it with. And then as you start to use product out of that bottle, you can simply just subtract from it. It makes it for an easy reference. That way you don't actually have to go back in and, log into your traceability or actually go and like draw up how much product is left in the bottle. You can simply just look on the bottle where it has been subtracted and that will give you the number that it's supposed to be. Any questions on that? Perfect. Okay, so we talked about how to chart last week. So before we kind of go over the promotions and wallet, I'm going to have everyone go through a patient chart. We're all going to do it together. So go ahead and open up Aesthetic Record on your phone. And you're going to now search for yourself your test patient. So you're going to hit the little blue bubbles at the bottom, or you can go to the very top and click search. And I'm going to type in test. And I'm clicking on my test patient. Okay. Once you do that, let's go ahead and let's schedule the appointment. So you're going to click the calendar in that upper right-hand corner, that calendar icon. So click that calendar icon. It's going to say the appointment and then the in-person. The appointment is in person. Choose the provider, select your name, and then you're going to select the clinic, which is also your name. And the service that we are going to do is going to be neurotoxin. So please click on neurotoxin. Once you do that, click on choose a date and we can select tomorrow and we can say 8 a.m. or whatever time you would like to say tomorrow. And then from there, go ahead and unclick the credit card at the very bottom and then click save. And then go ahead and you should be at this screen. Looks just like this. And click send notification. So the purpose of this is just to get y'all to have additional practice. Now that we've went ahead and booked that patient, now let's go ahead and chart the procedure. You're going to hit that plus button in that upper kind of right-hand corner and click on cosmetic. And we are also going to start with step 1 and click on the face. Underneath that appointment time, you're going to hit that little drop down arrow so it auto populates the appointment that you just booked. And then once everything has auto populated, you are then going to hit next in the upper right hand corner. Go ahead and select all 5 images and hit take pictures. And for now, just click use template. Please give me the thumbs up once you have done that and hit finish. Perfect. Thank you. Thank you, Lexi. Aaliyah, Heather. Good.
I got it. I'm good.
Okay, perfect. All right. And then now you're at the consents, right? It should say the neurotoxin consent. Go ahead and click on that red checkbox. And in the upper right-hand corner, click sign. And then you can just squiggle for now. And then you're going to hit that floppy disk in the upper right-hand corner. And then you're going to hit next in the upper right-hand corner. And then now it's coming to the health questionnaire. Go ahead and click on that red pencil. And it's going to say, are you a new client to MFL? Click no, and then okay. And then it's going to be no for the next 3 questions. Once you've done that, you're going to hit save and continue at the bottom. And then start. Once you're there, go ahead and give me a thumbs up. Good. Perfect. All right, the very first thing that we're going to do is we are going to pay ourselves. You're going to hit that little plus button right there that says next to product. And you are going to go to the retail tab and click on that $25 consultation fee. And then click add to procedure. And then we're going to hit that plus button again. Now we're actually going to do that product. And now we're going to go over to the product tab. And this time I want you to click on Daxxify. It's going to say Daxxify per unit. And let's go ahead and let's do her crow's feet. So we're going to do 2, 2, 2, 2, 2, 2. So double tap, toggle it to 2, double tap, and then do it on the other side. Double tap, double tap, double tap. It should look just like that. Okay, give me a thumbs up once you've done that. Great. Hit save in that upper right-hand corner. It's that floppy disk. And then now we're going to hit that back button. And then we would take payment, but we're not going to take payment right now. But I want you to go ahead and add your note. So underneath where it says more, you'll see something that says add note. So click on add notes. And then you're going to do the dot phrase. So you're going to click on that little space and it's going to be right there. Click on that little space to bring up your keyboard. And then you're going to do a period, and then it is going to auto-populate all of the different assessments. Please click on RN toxin or APC toxin, and then click save. Once you've done that, hit that back button and give me a thumbs up.
Wait, Anne, how did you get to, I'm still at so I just added all of the injection points for Daxxify, and then what do I hit the floppy disk?
Yes, hit the floppy disk.
Okay. And then
Hit the back button, the back arrow button.
oh, got it. Got it. Okay.
And add note, it's underneath, it says paperwork payment, it's under more, kind of in the middle of the screen, bottom middle of the screen. And it will say add note.
Ah, okay. I'm there. Okay. Okay, perfect.
All right, quick take payment. And this is what I want y'all to screenshot. And that's what you're going to put on the page. It should look just like this. So the total should be 145. Give me a thumbs up and then we'll move on. Good. Heather, are you good? Aaliyah, you good? Okay, perfect. Great. All right, now we're going to talk about how you do the promotions. So whenever you get to this tab, this is where you're going to give the patients the discount. So once you've done this, you're then going to use your finger and you can pull your finger, use your finger to pull that little screen down. Okay. And then you're going to click on the promotions tab. Okay. And I want y'all to click on that friends and family promotion, and you should see that it automatically subtracts from that 145. If you accidentally hit one, you can click it again and it will undo it. So if we have any promos going on, if it's like, Talks Wednesday or Friends and Family or self-injection, any of those, that all of those promotions are going to be under that tab. Now, if you toggle over to the wallet tab, right now it should look just like this, with the exception of the 200. It should say nothing is in there. So you are able, if a patient is a VIP patient, then they will automatically have money in there, and then you can take it at checkout underneath AR Wallet. So I just wanted you to show how you can add money in there, and that would be for in case if a patient accidentally tips or they pay over or anything like that. So you do it from the main page of their profile. You click those three dots, and then it will take you to their virtual wallet. If they are a VIP patient, it will say current balance and it will say the money that they have in there. But if you need to add money to it, that is exactly where you will do that. And it will be, you'll just take your finger and you'll click on it and slide it and hit add. Very simple. Okay. The next thing that we're going to talk about is enhancements versus a finesse. A finesse treatment is for a patient who might have a little bit of a spot eye or a little bit of a drop brow. That is up to 4 units of Botox, 4 units of Daxxify, and 10 units of Dysport. And that is only if it is needed. So if a patient does not need it, they can't bank that or anything like that. It's only if it's needed. And you would have to go back out and retreat that patient. That is not something they just need more units. And that's what an enhancement is. So an enhancement would be, let's say I go and I get my glabella done and I tell my injector, hey, I'm on a budget. I know you're recommending that I get 20 units of Daxxify, but I can only afford 10 units right now. Well, 2 weeks later comes around and I still have significant movement. I said, hey, I need to be retouched up. They have to pay for the additional units. So any questions on the difference between enhancement and finesse? Right, moving on. Okay, so for employee discount, every employee receives a 55% off of all of their treatments with the exception of weight loss. So how it reads in AR, it's going to be a 38% discount in aesthetic record, but then you get paid on it at 17%. So then that brings you to the 55% off discount. So I just wanted you to be aware of how the discount is applied. Okay, let's talk about the frontalis review. So in training, remember I divided muscles up into large and medium and small muscle groups. Whoops. Let me do this one. And what we're going to do is you're going to tell me if it is a large or small forehead. So what is this patient, large or small? Remember, a small forehead is
Large.
3 fingers or less. Large is more than 3 fingers. Yep, this is a large forehead. This is exactly how you would mark her. Remember, you go lateral canthus straight up, medial canthus straight up, medial canthus, lateral canthus, and then if the top layer is pupil straight up, nose straight up, pupil straight up. And you want to make sure you are at least 2 centimeters from the eyebrow, the natural eyebrow. If the patient is naturally hooded, you need to stay 2.5 centimeters. Okay, so if they say, hey, I usually get really heavy, go ahead and do 2.5. Okay. All right, what about this patient, large or small?
Large.
Large, very good. And she has some little rainbows right here too, right? So let's go ahead and let's see how we're going to treat this patient. So lateral canthus, medial canthus, medial canthus, lateral canthus. I'm going to do my 2 little dots for her rainbows, and then pupil straight up, nose straight up, pupil straight up. You essentially want to try to read the forehead like a book. Wherever it is having movement, that is where you're going to be injecting. Every patient is going to be slightly different, but this is the general idea of where you want to be injecting. All right, what about this patient, large or small?
Small
She's pretty, she's
or
actually
average?
large. Yeah, it looks small just from the picture, but so
Mhm.
this is how you would be injecting because this is 2 centimeters. And you see that she has a rainbow only on one side. So I wanted y'all to see a picture of a patient who has a rainbow just on one side. So the injections do not have to match on either side because everyone has a little bit of asymmetry. So again, lateral canthus, medial canthus, medial canthus, lateral canthus, pupil, nose, pupil, eyebrow lift. And remember, this is a medium muscle group, so you're going to be injecting 5 fluid units into each injection point. If I'm using Dysport, I'm going to chart 5, 5, 5, 5, 5. If I'm using Botox or Daxxify, I'm going to inject 5, 5, 5, but I will chart 2, 2, 2, 2, 2, 2, 2, and then this would be 1 because it's 2.5. What about this patient, large or small?
Small.
Yeah, it's a small one. Yep, she's got a small one. She's got a little bit of movement at the very top. So this is like one of my longtime patients. And so this is actually a recent development, this little dot up here. She has gone on a weight loss journey. And so she used to not need any neurotoxin at all. And now she's starting to lose some weight. And so she's starting to, unfortunately, get a little wrinkles in her forehead, but she loves them because she's losing weight. So she was happy to get the extra dot. So fluid wise, 5, 5, 5, 5, 5. If I'm using Dysport, I'm going to chart 5. If I'm using Botox or Daxi, chart 2, 2, 2, 2, 2. All right. The next one we're going to talk about is the eyebrow lift. So here's a quick little video.
Jellyfish Lighting is an all-in-one permanent exterior lighting system. Through an app on your phone, you are able to
a video on how to do a brow lift, and many of you asked questions on how I was able to inject underneath the eyebrow and not cause an eyelid-ptosis. Now, unpacking this is a very interesting way of understanding the anatomy because, of course, we are all very afraid of causing eyelid-ptosis. Now, many years ago, when I first started training, I remember training an ophthalmologist who told me that they injected the eyelid close to where I was just warning my trainees to be careful of injecting. And they used 4 units, so 4 times more than I would normally use, and he'd never had an eyelid-ptosis. And this really got me thinking much more about the anatomy. So by the end of the show, if you watch it all, you should understand the nuances of different muscles and how they are differently affected to what you may have first thought when you first learned how to inject Botox in this area. So many people were concerned that my injection points were so close to the eyelid that I may cause an eyelid drop. Now let's first consider what actually happens if you inject the eyelid. So people have purposefully injected the eyelid with toxin, and you'll be surprised to find out, if you didn't know this already, that what will actually happen is your eyelid will actually lift. And that is because the superficial muscles that are in the eyelid are actually the protractors of the eyelid. They are not the retractors. So the retractor muscle is the levator pulpebri muscle, which runs in the orbit. And this is what we are concerned about not injecting. Whereas the orbicularis oculi, which actually runs in the eyelid, if you inject that, actually allows your eyelid to open slightly, because when you close your eyes, it's contracting, you relax it, it actually opens. So it's actually the reverse of what many people think, because they haven't thought about where the muscle that lifts the eyelid actually lives, which is in your orbit. So understanding this is the first thing around why you don't need to worry too much around eyelid-ptosis. But there are other elements too, because of course we can get eyelid-ptosis from injecting superior to the eye. So we need to think about what injections are likely to be causing that and what we can do to avoid it, and why my style of injection in my career has never caused an eyelid-ptosis in any of my patients. So that's part one of what to understand. We need to think about which muscles are likely to be involved and what injecting toxin actually does to them. If you're injecting superficially and you inject orbicularis oculi, you will find the eyelids actually more likely to lift. In fact, it's now a treatment for eyelid-ptosis when you've injected the other muscle, the levator pulpebri muscle. Knowing precisely where these muscles are and what layer they're in will give you confidence to inject in areas where other less thought out clinicians will think you're going to get an eyelid-ptosis. So let's think about the layers in this area. Obviously at the top you have the dermis, then you have a thin layer of fat in the hypodermis, and then you have the orbicularis oculi muscle. Underneath that, there's the retroorbicularis oculi fat pad. Then you have the orbital septum, and underneath that you have the preseptal fat pads, and underneath that you have the levator pulmonary muscle. So there are actually multiple layers. So to help you understand this, let's think about the face and the anatomy in this area, not with all the difficult medical terms, but just as a sandwich. Imagine that you're having a sandwich on your mum's favorite tablecloth. That represents the most precious part of the anatomy, the orbit. We don't want to get ketchup on the precious tablecloth. And of course, if you make your sandwich directly on the tablecloth, you're going to make a huge mess and cause your mum a lot of upset. Or your dad. Might be dad's favorite tablecloth too. But what we actually do in real life is you have layers that protect that tablecloth. We have a placemat on top of that. You could think of the placemat as the preseptal fat pads. And on top of that, you have the plate, which you can think of as the orbital membrane. On top of that, you have your first layer of bread, which is the retroorbicularis oculi fat pad. On top of that, you may have the meat, the muscle. On top of that is where we try and put our ketchup. And one layer on top of that is the dermis. So actually, the ketchup is shielded from the tablecloth by multiple different layers. And it's exactly like that with injecting botulinum toxin. We're actually injecting tiny amounts just on top of the muscle, and we have multiple other layers shielding those important structures in the orbit. And it's the depth of injection rather than the position relative to the eyelid that keeps those internal structures safe. Another question that we got many times was, how many units do I like to place in the dots underneath the eyebrow? I find it really helpful using just a 1 unit dose, and this is enough to get a difference. I'm not necessarily trying to paralyze the bulk of the muscle. I just want to affect those fibers that are pulling the eyebrow down. This is also a safer amount. It's a bit like, to go back to our analogy, like using less ketchup. You're just less likely to get an inadvertent mess. So small amounts, wherever you can use them, are always safer. As a general rule of thumb, the dose response curve is less likely to cause you a problem. So that's why I use 1 unit. I typically use 1 to 3 units underneath the brow, and then I'll use my stronger doses where the licensed dose is higher at the lateral canthus. In terms of dilution, I usually use the standard dilution of 2.5 mils in 100 units of botulinum toxin, but sometimes I'll use a more concentrated form if I'm in an area where I just want to make sure there's less chance of a spread. But I used to do that a lot more than I do these days. I've had so few complications that I very rarely use different doses. When I do use the more concentrated version, it's in the lower face. Injecting the depressor angularis oris or the mentalis, I feel safer using a more concentrated dose. For most of the rest of the face, I dilute 100 units with 2.5 mils of bacteriostatic saline. Another question we got was, does the brow lift occur from injecting below the eyebrow or also from injecting above the eyebrow? And in fact, years ago, I had patients who would come and say, no, I've had an eyebrow lift, the doctor injected here, you have to do the same in order to get a lift. Now, if you think about the anatomy, this cannot be true because these are the elevators. And if you inject the elevator of the eyebrow, you're going to decrease the power of that muscle to lift. So you're actually more likely to get a drop. And in fact, most of us are very afraid of injecting directly above the eyebrow in the frontalis muscle because that is where you lose the eyebrow arch. So you only get a lift when you affect the little tug of war that's going on with the eyebrow between the two muscles. One's an elevator, one's a depressor. So if we weaken the depressor, which is the orbicularis oculi muscle, and you can see this because if you want to lower your eyebrow, shut your eyes very tightly and you will see your eyebrow comes down, and that's caused by orbicularis oculi. And the frontalis muscle does the opposite. So the tug of war is won by reducing the strength of the depressor, which is orbicularis oculi, not by treating the frontalis muscle above it. However, the other way we create eyebrow lifts is by increasing the resting tone of the lateral frontalis muscle. And this is done when we treat the middle of the frontalis and the lateral gets more active. So in some of my videos, you'll see that I draw cat ears, we call them, and I tell injectors generally not to inject in those cat ears. Now, those cat ears represent the elevating part of the frontalis muscle. So when I say that it reduces the chance of a ptosis, I'm talking about a brow ptosis, not an eyelid ptosis. And this is one of the biggest confusions that happens earlier on for people, is differentiating between a drop in the eyebrow and a drop in the eyelid. And nearly all of the cases I get sent are actually drops in the eyebrow, not in the eyelid. The actual eyelid is stable, but it's rested on by a heavy eyebrow. Typically, if they have extra fat above their eyes and that's resting, or they have an eyelid shape that just naturally transmits energy into the eyelid, it confuses injectors. But that is all to do with reducing the strength of the frontalis muscle in this crucial area that elevates your eyebrow laterally. So the more botulinum toxin that you place in this area, the more likely you're going to have that problem. And so particularly in females and not so much in males, I don't treat that area because I want there to be an eyebrow arch. Females also tend to use their eyebrows in a different way to men, which is to do with applying makeup. Every morning, if you apply makeup, you tend to lift your eyebrows up, whereas men do not notice the loss of movement laterally. So you can actually treat men quite often with more Botox in the cat ear and weaken the frontalis muscle all the way across, and it does not cause any problem or concern at all, whereas a female will miss that ability to raise their eyebrows and apply makeup. Other injectors were concerned by not treating the cat ear area that you may then cause a Spock brow. And in fact, this could be part of a Spock brow. Typically, I think of a Spock brow as a medial brow ptosis and a lateral brow lift. So if you overtreat the middle and undertreat the side, then absolutely you get this disequilibrium, and you have too much activity and too much heaviness in the middle, and that creates this unpleasant shape. So it is possible that you could be on that spectrum. Like everything we do, you're trying to make the adjustments to get a happy medium. So I want a little bit of a brow lift, not a huge one, and I adjust that sometimes by putting one unit in the top of that triangle of the cat ear, and that's typically what I'll do when I know the patient or when I'm confident that they have quite a strong frontalis. I will treat within the cat ear area. I think sometimes people see these markings and they think it's a definite no-go area. It's actually not. It's just an area that I'm more cautious of injecting, and it's helpful if you know you're creating an eyebrow lift, and if you don't know the patient, to start with leaving it undertreated and then to treat them at a follow-up and then make a note of where that treatment was. So then you have a plan that will work each time you see them. But the first time you treat someone, particularly if they're a little bit older and brow drops a little bit more likely, it just makes sense to see what happens with those units, get the result back in 2 weeks, and then make an adjustment, learn from it, and then you can repeat safely whatever you learn from that patient in the first course of treatment. So I hope that's helped you understand in more detail the three important muscles, particularly with respect to eyelid drops. So we've got the levator pulpary muscle, the orbicularis oculi muscle, and the frontalis muscle. And if you take away anything from this, it's the three-dimensional injection depth that matters most in terms of safe injecting around the eye.
All right. So I think it's always great to see how other injectors do their eyebrow lifts and everything. I inject very similar to Dr. Pierce as well. Yeah. While I'm pulling this back up, does anyone have any questions about it? Okay. Okay. All right, the next thing that we're going to talk about are the little bunny lines. So bunny lines are formed from two reasons. Remember from training, it can be from the very bottom part of procerus, and you'll get that horizontal line, but you will also get it from the nasalis muscle, and it's the crinkling of the nose. I treat it as a small muscle group, so I will usually do 2, 2, 2, and 2. This is one of the only injections that I will inject while the patient is animating, and the reason why I do that is because it gives you a little bit more tissue to work with, and it makes it a little bit more comfortable for the patient. So I'll show you this. It's a lot of links tonight, a lot of different videos we're going to be watching. So you can see she's kind of crinkling her nose. You're going to hit it from the side, 2.5 fluid units. And then on the other side. I think this video is funny because she definitely used all of it in that second one. There wasn't anything left, but whatever. All right, that is how you inject a bunny line. The next video that we're going to watch is about the microneedling pen. This is specifically from MD Needle Pen, so this is their training. It's not super long.
What is microneedling with the MD Needle Pen? Microneedling, also known as collagen induction therapy, stimulates the body's natural healing process by creating microchannels on the surface of the skin. This procedure leaves the top layer of the skin intact, allowing for shorter healing time and the ability to treat many different skin concerns. Each microchannel allows for the absorption of serums, hyaluronic acid, and PRP when used during the treatment. The body is stimulated to fill these microchannels by producing collagen and elastin, resulting in smoother, firmer, and rejuvenated skin. The motorized technology of the MD Needle Pen has the ability to adjust the sterile needles to depths ranging from 0.25 to 2.5 millimeters. These variable depths allow for the treatment of deep wrinkles and acne scars, in addition to delicate areas around the lips and eyes. Microneedling is an effective treatment for many skin concerns, as we can see by analyzing these real-life before and after photos. Before treatment, observe that the acne scars are very deep and pigmented, but after microneedling, the skin is smoother and pigment is diminished. Notice the pronounced smoker's lines here before microneedling. After treatment, the lip lines and wrinkles are minimalized. Here, we see increased skin laxity and rough texture before treatment. Once microneedled, the skin is tighter, firmer, and smoother. See the sun damage and uneven tone in this patient's skin before treatment? After microneedling, pigment is lightened and the skin tone is more even. Notice the brown spots, wrinkles, and skin texture before treatment. After microneedle therapy, aging skin is less crepey with reduced dark spots. Before treatment, we see stretch marks that are very dark and highly visible. After needling, they are smoother and the color is less prominent. Before treatment, there is a noticeable shortage of hairs on the scalp. After skin needling, the number of hair follicles is dramatically increased. Clinical studies have shown microneedling as a safe and effective alternative to ablative laser treatments. With no thermal injury to the skin, a short healing time, and the ability to treat any skin type, it is a skin transformative procedure for every person. Clinical specialists designed the MD Needle Pen with durable stainless steel outer shell for reliability and gave it the ability to be used corded or cordless for flexibility. The surgical-grade stainless steel needles are individually sterilized for patient safety and comfort. MD Needle Pen is committed to patient results and has developed unique advanced protocols from actual in-office procedures. To learn even more, we have a clinical study underway with Shriners Hospital for Children for the treatment of hypertrophic burn scars. Microneedling is a safe and effective skin rejuvenating procedure that uses the body's natural cellular regeneration to stimulate collagen production. If you are interested in this unique anti-aging treatment that tightens, lifts, and smooths the skin, visit us at mdneedlepen.com or contact one of our local practitioners.
Okay.
I was treated for my moderate to severe frown lines, crow's feet.
And then last video, I know it's a lot of videos on this week. This one is for the Perfect Derma Peel. This is our chemical peel that we use. And so after today, you are free to start treating your patients with the Perfect Derma Peel. I recommend that you try it or, try it like on a close friend or family. So that way you can really kind of see firsthand the amount of peeling that they have. This is truly a medical grade peel. So please know that they are going to peel like a snake. It's what they want. This is not just a light dusting. This is peel. The skin underneath it is baby skin and it is like unblemished and beautiful. It is a great procedure to add with microneedling. I am a picker, and so it was really hard for me to not pick at it, but I do this peel on my daughter. I do it on myself. I have a lot of patients that do it. It is a fantastic peel. It is self-neutralizing, which means you do not have to put the base on there to neutralize the acid.
Welcome to the Bella Medical Product.
I'm going to fast forward just a tad, because you don't really want to hear the
Results to the aesthetic medical community. The Perfect Derma Peel is a safe and effective treatment for aging skin and is the only peel to feature glutathione, an antioxidant with powerful anti-aging benefits. The Perfect Derma Peel is available throughout the U.S. and is growing in popularity worldwide.
Hi, my name is Lana Petrovic. I'm the Director of Operations for Bella Medical. Minimize the appearance of pores. The Perfect Derma Peel is beneficial for all skin types and all ethnicities.
I feel very comfortable using the Perfect Derma Peel because it's very safe, and at the same time it's very effective, very result-oriented.
The Perfect Derma Peel is one of the easiest peels I've ever performed. I've been giving peels for 20 plus years in this business. It's 1, 2, 3 easy. It's a half-hour process. They're fairly comfortable throughout the entire procedure. It's great. They're up, they're gone, they're fine. They absolutely love the result. It's a great thing to do when you're preparing to go on a vacation or a wedding. Anytime you want your skin just to look flawless, they absolutely love the Perfect Derma Peel.
Hi, I'm Michelle Ray with Bella Medical Products. The Perfect Derma Peel is a medium-depth medical-grade peel featuring a unique blend of acids that address many common skin concerns. The peel contains TCA, retinoic, salicylic, and kojic acids, phenol, vitamin C, and antioxidant glutathione. Each acid is under 12%, and the peel is pre-mixed for easy application.
I really enjoy working with Bella Medical because the customer service is amazing. I mean, I've never had any issues. It arrives on time, the product is consistent, and they're really easy to work with.
I am Nafis Sabai, the founder and CEO of Bella Medical Products. We are committed to providing skincare products that deliver superior results to the aesthetic medical industry. We are happy to welcome you as a provider of the Perfect Derma Peel.
Hello, my name is Juliana Wagner. I am a licensed esthetician of 20 years, and I'm also the senior trainer for Bella Medical Products, and we're here to do the Perfect Derma Peel today. So Natalie has concerns with fine lines and wrinkles, so we're going to do the Perfect Derma Peel on her today to bring back that healthy glow to the skin. So what we prep the skin with prior to the peel is 100% pure acetone. It degreases the skin so that the peel gets down into the skin evenly and deeper into the skin as well. I'm going to have you hold your breath and tuck your lips, please. Any areas of concern, such as fine lines and wrinkles, as well as hyperpigmented spots, deeper lines, you want to be more aggressive with your acetone in those areas, again, to get that peel down in there to do a better job. A good 2 to 3 passes is necessary. Next, we're going to go ahead and put the peel into the cup here. And you're going to want to apply it with one of the 2x2s that come with the peel. And you're going to fold it into a little bit of a square. In our first pass, we're going to go lightly just to numb the skin. How are you feeling, Natalie?
I'm good.
Good. So the active ingredients in the Perfect Derma Peel is the TCA, salicylic, retinoic acid, vitamin C, glutathione, kojic acid.
It's kind of tickle.
And with the phenol in there, you don't have to have the pain. We're going to feather into the neck 1 to 2 layers, and directly underneath the eye 1 to 2 layers as well. I'm going to have you look up towards me, please. And go ahead and close and relax. You're going to layer the peel till it's gone. You're going to look for frosting as your end point, as well as erythema. You want to redip often into the cup so that it stays nice and even throughout the peel. I'm going to have you look up towards me, please. And that'll be the last layer underneath the eye as well into the neck. And then we'll finish the peel throughout the rest of the face. Almost done here. And you just want to work it through once your cup is empty till your gauze is practically dry. And that's it. As simple as that. So next, we're going to go ahead and go over the post-peel kit with Natalie. Natalie, the peel is supposed to be left on in 6 hours. It self-neutralizes. So you can wash your skin in 6 hours, but preferably I'd like you to go ahead and leave it on overnight if you're not uncomfortable in any way. In the morning, I'll have you wash with a very mild cleanser, and then you're going to go ahead and I'm going to recommend that you take one of the 2 towelettes that are in your post kit. I'm going to hand you the directions as well. And this is a towelette that you're going to use on clean, dry skin tomorrow morning. And this has vitamin A, so it's going to help to expedite the peeling process. So we'll go ahead and you'll use the towelette fairly aggressively. You're going to rub throughout, make sure you get under the eyes really well, and also feather it into the neck. You're going to go ahead and wait at least 30 minutes before applying any sunblock on top. And then you're free to wear makeup that day if you choose. Then that evening, I'm going to have you go ahead and I'm going to have you cleanse again with something mild again, and then go ahead and use your second towelette. And again, very aggressively, you want to rub it throughout the face, feather it into the neck and under the eyes, and then just go ahead and sleep with that on overnight. Okay? Then after that, the next day you're going to start to see that you're going to start to peel around the mouth. And that's where we talk and move our skin the most, so it'll peel first, and then it's going to kind of just slowly peel out for you. So during that process, you're going to use the hydrocortisone 1% cream that's in the kit as well. And that's all you'll need along with your sunblock. Okay, and then it is a 7-day process, and then you're going to just look beautiful and glowing as you naturally are.
Thank you so much.
All right, thank you. Prior to the application of the Perfect Derma Peel, it's important to go over the contraindications with your patients. Contraindications include pregnancy, breastfeeding, Accutane use within the last 12 months, hypersensitivity to any of the peel ingredients, or aspirin allergy. Do not apply to skin that is still irritated from any harsh treatments such as lasers, waxing, electrolysis, or chemical exfoliants. Do not apply to open wounds, sunburn, infected skin, cold sores, herpes, or lesions. It is important to advise patients with a history of cold sores to be given an antiviral prior to the peel. For overall rejuvenation, we recommend doing the peel no more than 2 to 4 times per year. However, for chronic conditions such as acne, hyperpigmentation, melasma, and concerns with fine lines and wrinkles, we do recommend a series of 3 peels 30 days apart. For thicker and more resilient skin types, melasma, and acne scarring, we recommend adding the Perfect Derma Plus Booster to the peel solution for optimal results. The peeling process will vary per person based on skin type and skin condition. The peeling process will start within 48 hours, intense peeling for 2 to 3 days, and an additional 2 days remaining with the residual around the hairline and neck areas.
If you have any additional questions or need more information, please feel free to contact your local.
All right, last video, I promise. No more videos for tonight. Okay, so the next couple of things that I want to talk about be really fast. These are just different marketing ideas. I know that y'all did a call specifically with Shelly over marketing, but these are just some additional things that you can do. You can do before and after graphics, and you are free to make any graphics that you would want. You can also do some education posts. An example is for education on microneedling. And then I have another one on here. Let's see, I'll go to it. I have an idea of joining a networking group. You can do before and after of chemical peels. You can do other education stuff. One thing I do want to talk about on here is starting your social media following. So as you progress through your aesthetic career, there is going to be so many different people out there that are fantastic educators and you can really learn from. Be a sponge and try to learn everything and anything that you can. So these are 2 injectors that I recommend. And then on the next page, I have 2 more, and then I have a podcast person that I really like. Obviously, I like Tim Pierce. I think he's really great. There's some really, really good different educators out there. Injector Bunny's really good as well. Now, the podcast on here is Jessie Lee. She is not in medicine. She is more of a network marketing person, but she gives great advice of just kind of getting out of your own head and getting yourself out there. And as nurses and as medical personnel, we really kind of struggle with that. So just know she does kind of cuss a lot. So don't listen to it if you have a bunch of little kids around. All right. And that is it as far as the marketing. And then the last thing is going to be for memberships. It's really easy to sign a patient up for a membership. It's going to be directly in the app. And so whenever you click on the patient, you can click on these 3 little dots in the upper right-hand corner and click on membership. And you can add the membership from that add new tab, and you simply fill everything out. Insert the patient's credit card. You're going to choose yourself as the injector, and then it will automatically start giving them that money and taking it out of their bank and putting it into their virtual wallet so they can use it whenever they want to have aesthetic procedures. Just know that it does roll off at every 12 rolling months. So please know that. So use it or lose it, but it guarantees them a discount on everything. And that is it for today. Do y'all have any questions for me?
I have a few.
Yeah.
Okay. So I did my first chemical peel yesterday.
Okay.
And I'm actually excited to see her results because I want to do mine myself. But I also saw on the website they have like boosters. Do we offer something like that? I saw something like a clear booster.
We can get them if you would like. You just have to request it.
Okay. And then the other question that I had was, as far as the salon memberships, I had filled out information for my NP. She wants me to partner with her to inject. But I don't know as far as after I fill it out, like what kind of.
Contact Ashley.
Okay. Okay.
Give Ashley.
They said I see them like every week. So I went there a week later and I'm like, have you heard anything? They're like, let's check the email. And they're like, no, we don't see anything. So
check with Ashley. She does all the salon stuff.
Okay.
Yeah. And we were like 3 days deep in training in a row. So she just might.
Yeah, she told me she was out and about. So
yes.
I figured that's why.
Yes. All righty. Any other questions?
The recording of this, is it available on the Facebook page? I missed the first part because I'm traveling and didn't have service.
Yeah, no worries. It's hopefully I recorded it right. Yes, it's recording.
Yeah.
And I always feel like my heart always drops when I'm like, oh shoot, I hit record, right? And then that way I'll put it on the Facebook page tomorrow. Also, that there is my my YouTube channel. I have on my YouTube channel where all of these essentially kind of go. It's every single recording I've ever done for the last like 8 years. So if you are ever bored one night and you're like, I want to hear how MFL ran 8 years ago, knock yourself out. But it lives on there. So even after you're kicked off of the onboarding page, please, like, everything is living there for y'all.
Okay, cool.
Yeah. All righty. Well, I hope y'all have a great evening, and I will see everyone next week. Bye, guys.
Bye.
Thank you.